Hello everybody. How are you? I would love to talk to you today about a video in regards to what things and what steps happens from consultation day to your surgery day. I have not seen no videos out there that will talk more about that. So this is more like to kind of guide you to the step-by-step process of things may happen, but also keep in mind that every clinical practices, any plastic surgeon practices, they run their practice differently. So do not panic if it's different than mine or yours. Just kind of have that in mind. Also, we'll add a little clip that my expert surgeon will talk about what he found and also what procedure ended up having. So it kind of gives you some more idea of what it is. So this is part 5 video, so of the Explant series. Just keep in mind I've made other videos previously in regards to medications, in regards to steps to find your appropriate Explant surgery. So check out those videos whenever you get a chance, so it kind of give you more an idea of what has happened in my journey, and also can help you to help you with this process as well. So yeah, let's start with this video. All right, so my consultation, I ended up making a consultation on July 18th of 2022. And I didn't know ahead of time. Once I found out in my heart, I had a gut feeling that Dr. Deb was my expert surgeon from the start. After collecting data, after comparing different reviews, after comparing notes and doing all my own research. And that's why I tell everybody, before you decide to pick your right doctor, you have to do your own homework. You have to do all the work on finding out why you're choosing the right person, right, to operate on you. This is a big journey, big surgery. So you have to be over 100% set on knowing that person that you are choosing is the right one for you. So yeah, check out the video that I told you about why I chose my plastic surgeon, my expert surgeon, Dr. Dev. So can I give you more idea why? So anyways, after consultation, once I walked out of the office, I knew hands down 150% Dr. Dev was the one that I will be choosing. That day, I ended up picking April 18th, 2023. I did that a year difference just due to the fact that I was going to school. I had a lot of stress. I had a lot of projects to do. I had a lot of things on my plate. So I knew right then I'm not going to pick any date anytime soon. Obviously, you have to gather all your situation in hand as far as like if you're having. I had a list of symptoms. I know other women suffer more than I had, and I can understand. In my case, I was definitely going through my own type of suffering. I was able to manage the best that I could, but I had so much on my plate at the time. So I ended up choosing around April on this date because I was finishing school. So it was a perfect date. I also want to mention to make sure to pick up the date that you don't have that many obligations around that date, right after surgery, because that time is the time for you to heal from surgery. This is a big surgery. So you have to keep in mind that you have to have the least possible stress possible after surgery, because at the end of the day your body's going to read all the stress. It's going to really feed from that, and it's going to delay the healing process. So that's something that I really want to tell you, ladies. To pick the right date the best that you can, you have to give yourself at least 2 to maximum 6 weeks to just heal, because like I said, anyone can go back to work maybe a week after, maybe 2 weeks after, maybe 6 weeks after. So it's more like the time frame that what I hear from other women. They hear from either 2 weeks to 6 weeks is usually the time frame where you are able to say, okay, I'm good, I'm able to go back to work. So like I said, you gotta just listen to your body and do the best that you can for yourself in that time. All right. So okay. Uh, in this case, a month before surgery day, about March 24th, 2023, I ended up having my pre-op date of to come in to the office, and the nurse will check all your lab work. She's going to check of how you're doing as far as your baseline and physiologically, as far as your lab work on CBC. That's when they're going to check if you're probably suffering from an anemia or you are possibly having an infection. You'll be surprised. You see anybody out there, you think, okay, that person is healthy, but at the end of the day, they don't know how it's going. Your body is functioning right? So they have to do this lab work, which is just a normal general protocol that happens in every practice. Do not panic. This is just the way it goes. So, and the CMP is basically to check if there's any type of deficiencies going on in your body, like electrolytes, check out your fluid balance is going on, and then check out further on your renal and also check out your functioning of your liver. Also, the EKG is to check your heart rhythms. It's just to see if there's any irregularities going on that you probably, if there is one irregularity, for example, they're going to ask to further evaluate, with a cardiologist, so you can more or less like to check what things that you need to do, right, to get back in order to proceed for the surgery. So this is just general lab work that they will ask to take. And this happens usually a month before surgery, and that's the time that you're going to ask to pick up your prescription at the pharmacy. And a few days before surgery, you'll have to pay the remainder of the balance. Remember, the prices, every prices is different, from either you have a left or no left, and either you add more extra services like a nerve block will add more on the price. So you have to call in the office to find out further in that area. So one day before surgery, the nurse will call you as well as your anesthesiologist. It's just to check on you, that's the time definitely to ask any last minute questions that you may have. And this is the thing that I tell to patients, to please write any questions down on a paper, so to remind yourself those are the things that you need to ask. As a human being, we all have last minute questions. Even a MNRN has still had last minute questions. So it's normal to ask questions, and if you have any concerns, do not feel shy to ask. And that's something that I tell everybody, to speak up, right, on that area. All right, so surgery day was April 18th, finishing school. I didn't have that much stress or any due dates that I had to accomplish right after, so I knew I was in a good shape in that area. So I was asked to come into the office at 6:30. Surgery started around 7:30. Left the office around 10:30, 11. Remember, when you wake up, you're still under anesthesia. You not fully, you're awake, but not really fully awake 100%, because you're feeling really quite good at the time, right? So the nurse, once you wake up, the nurse will tell your caregiver to come in to by the nursing room, to explain to them as far as what instructions they need to keep in mind to do. But before surgery, obviously, you're gonna be checked your blood pressure, and also collect urine tests to see if you're pregnant or not, just to kind of, it's part of the protocol. Like I said, they're going to check all this, and they're going to check all this before surgery, just to see that you're in good shape, right, in order to move on forward for the surgery. You will be asked to put a gown and hairnet and socks. So once you take the blood pressure, collect urine test, and you're good, they'll ask to put your gown and get ready to be set for surgery. The anesthesiologist will come in the office. He's gonna set you up, put the intravenous fluids, and set you up with an IV. So then you'll be asked to walk in the OR, and that's where your explant surgery. In my case, it was a wonderful explant surgery. Dr. Dev was waiting for me. The last thing I remember he held my hand and told me, "You're in great hands." And before I know it, I was out. I mean, he is just the most wonderful. He gave me this warmth smile. He was just overall a great human being, period. I always tell him that every time I see him. Wonderful practice. I have nothing negative to say. He did pretty much exceeded all my expectations. So once you wake up, you'll be wearing this surgical bra right here, and you'll be having an ACE bandage. In my case, I had only a explant surgery, like total scapholectomy. I didn't have no lift. So my surgical site was really underneath the breast folds right here. And obviously, automatically, when they take a foreign body out of your body, it's going to create a hole, right? Hollow area right here. So there's going to be fluids and blood filling up this area, because that's just how your body will react, right? And you'll have a JP drain right here on the sides where the surgical sites are, and so is the other side too. And this ACE wrap is going to be around this area of the breast, just because they need to help heal and help reduce the amount of fluids collected, right, in that area, and also help with the healing process, inflammation. So you may feel like it's a little tight, but that's just the way it is, in order to help you in that area. All right. And so like I said, after you wake up, you're going to have all this on you, and you will be giving when you wake up, basically, the nurse will call your caregiver in, and they're going to instruct your caregiver what things they need to do and when to take this and when to take that, and basically to log any outputs from your surgical JP drains. This is called the bulb. So I will go over this quick little video right on the point to kind of help you out how to empty it. They also, the caregiver is going to give it's going to be giving a package instructions, medical instructions of what happens every week. So it's actually a great idea from being a nurse. I really do think this is a great idea for anybody not familiar with this area of practice, to what they will expect more or less of what happens each week. But keep in mind, this is not a one size fits all. It's not going to happen in every person, but it's good to have more idea of what may occur, right? Also, you are asked to come back the next day after surgery on 1 day post-op, just to check out your surgical sites. In my case, they check that surgical site, that you're going to check if there's any bleeding going on, any excess fluids coming out, there's anything going on that is not a normal. They're going to change your tapes underneath your breast folds. They're going to look into the JP drainage right on the sides of your breast. The same thing, they're going to check if there is excess of anything, any infection going on. So just to pretty much clean the area. You were asked to come back a month later. Also, I do think that it's great to know that any practices that you have, any explant surgeon that you end up choosing, they're pretty understanding as far as your scheduling. End up having a 3-month scheduled post-op on past Tuesday, and it's been due to the fact that I've been moving. So they're really, really great on able to accommodate you the best that they can. That's a great plus in my case, and I was grateful to see Dr. Dev before I moved. So it was just such an all-around wonderful appointment. I'm going to give you a little quick video where I'm at right now. Everything is positive, and let's go on. All right, this is like a quick video that I promised you. That is basically, this is my Dr. Deb, my little angel right here. He's wonderful. He will explain to you what my surgery was about and what he found, so it can give you more an idea of what really happened. So let's go.
Ceremony, we have both your implants, full capsules. These were underneath the muscle. Your left side was really contracted and tight in there. Both were stuck onto your rib cage. I did controlled total capsulectomy, so just in order to see the little capsule, I made little cuts in the actual capsule, pulled the implants out, and safely removed the capsule in one piece. Did a little bit of peeling, scraping, cauterizing, more on the right side than the left side. The right side was really stuck onto your rib cage. Everything had dropped a little bit. Your left one was stuck higher and almost was distorting your muscle and your tissue, but everything came out great. I'm glad you got these out. So with total capsulectomies, my cut's already made. I'll just peel that off, and so this is your whole capsule over here. So you can kind of see it gets a little bit stuck on the rib cage in this area, but capsule looks good. A little bit of a slimy feel to it, and that's pretty characteristics of these textured implants that you had. You had a CUI 300 grams textured silicone implant, no ruptures or leaking. Just a lot of inflammation around the tissue, and I definitely think you're going to feel better now that these are out. And then your left side, another total capsulectomy, so you can see much thicker contracted tissue. It was really distorting your breast tissue, but I was really happy with the way everything came out. Same thing, sticky, slimy consistency to it, pretty typical of these. You have a CUI 300 grams textured silicone implant, no ruptures or leaking. So we have 2 full capsules, total capsulectomies controlled. Grade 3 capsular contracture on the left, the way it was distorted and tight. Textured silicone implants underneath the muscle. I think you're going to feel great. That's your capsule cutting ceremony. Thank you.
Yeah, this is a great video. Actually, I did learn a lot, and to see how these breast implants have caused me so much misery, and makes me look it makes you look into like how damaging can do to your body. And yeah, it definitely was an eye-opener video. It makes you really do appreciate your body of how incredibly heals right after. And, I have like a new appreciation and new respect and new love, on myself, right? And, I hope that happens the same with you. And yeah, this is, definitely want to share this with you. And also want to share something too that, um, it's basically this goes for anybody, especially for anyone that doesn't have any healthcare background. I do believe that it helps with your ease your nerves is to find I call surgery buddy. That's what I call. It's a person that has either that is close by, nearby your surgery date, something similar that you both can share and can help, cheer each other out and like really like support each other emotionally. I think it's a great idea to find that person. I did find Amber. Amber, if you're watching this video, it was really sweet to meet you, by the way. She is I call my surgery buddy or twin buddy, whatever you want to call it. But I think she was really sweet. I hope that I helped her out and in a way of explaining things like that. But I think it helps for anybody to kind of help each other out, close to your surgery day, so you can have somebody there to, to hold each other's hands and kind of checking each other out. And I think it helps you to ease your nerves in that area too. So yeah, I found, I think it's a great idea if anybody would love to, if post anything on this page, as far as when I put this video up on any social media that I have. I will post a video in regards to who's having a explant surgery on this specific month, and everybody can post under comments, so you guys can find each other that way and help each other out in the future. I think it's a fantastic idea. If you guys agree, go ahead and feel free to connect that way. And yeah, I did find it that it was a great idea once I found Amber. I think she was so sweet. I totally do understand that everybody may have go through a lot of stress and a lot of nervousness because this is like an unknown, right? Surgery. We all going through the same thing. So yes.
Ceremony, we have both your
So I want to say thank you to everybody for being in this video and really like able to be part of this channel. I really do appreciate you all. Thank you for watching the previous videos as well. And yeah, I really want to let you know that I'm here for you. We all gone through the same thing. I've been a patient and I'm going through it. I'm on my 3-month post-op and a couple of days after. So I'm doing wonderfully. I want to put a little quick video where I'm at today. And like I said before, you are the captain of your own health.